Dear Hannah, in all the hospitals I've been to, it is difficult to implement this approach solely due to the South African context. Unfortunately, due to the demand for our services, it is difficult to dedicate all of my time to the patient and provide them with 100% of my attention because I worry about the other patients that still require my services. Additionally, hospitals rely mostly on assessment results, especially when needing to make referrals. As a result, I tend to dedicate most of my time to doing the assessment, investing little time in the case history and feedback parts of the clinical encounter. This not only resulted in me not being able to establish a good rapport with my patients, but also has weakened my therapeutic alliance with them. However, recently during my community block, I've been tackling a new approach whereby I invest a little bit more in the case history and feedback in order to understand my patient as an individual and strengthen my therapeutic relationship with them. I hope to continue engaging in this manner with my patient to ensure they are treated holistically. Do you have any thoughts or ideas on what I just said? Thank you so much for listening to my story. Love, Kelsey.
Hello everybody and welcome to our garage. So today, to discuss Kelsey's concerns, we're going to be going through the tools that are necessary to develop a successful therapeutic alliance throughout the test battery with our adult patients, despite any challenges that we may face in the South African context. So as you can see, we have our tools in front of us. Each tool here represents a skill or a factor that is necessary in developing a good therapeutic alliance throughout the case history, the examination phase, the feedback phase, the patient education phase, and the patient monitoring of motivation levels phase. With that, let's get started. So first up, we have our case history. And the first tool that is needed in case history is empathy. This is giving your client a safe space in which they can share their feelings. It's showing genuine concern for your patient and putting yourselves in their shoes so that you can have a better understanding of them. Next up, we have verbal communication. So the way in which we verbally communicate with our patients is extremely important because A, it's giving them the necessary information, but B, it's also bridging the gaps in their understanding. The key points to verbal communication is to be open, to be honest, and to be compassionate. Next up, we have non-verbal communication. So these are your facial expressions, your hand gestures, your body language. These all have emotions that are more powerful than simply words alone can convey. And lastly, in our case history, we have active listening. So this is showing your client 100% of your attention and validating their experiences. It gives them a safe space in which they feel heard and understood and valued.
As we proceed to the examination phase of our test battery, our toolbox becomes more specific to the individual needs of our patient. We've got 3 tools that we can use to help foster a successful therapeutic alliance with our adult patients in this section. The first tool we have is adapting test procedures. This involves considering any physical limitations or comorbidities that the patient has which could impact testing. Our second tool is providing our patients with an appropriate test description. This helps our patients know what to expect and can help calm them during the test battery and give them a sense of control. Our third and final tool for the examination phase is utilizing a therapeutic approach. This means that empathy is present at all times, which can help ease some of the anxiety and worry which frequently accompanies testing.
So now let's talk about the journey that our toolbox takes us when it comes to diagnosis and treatment. So in other words, the feedback that we give to our patients at the beginning of the management journey. So starting off, we have shared decision making. This is basically empowering your patient to become active participants in the decisions regarding their healthcare. It's collaborating with your patient when we're making the management plan because it's going to improve adherence to the therapy and it's going to improve outcomes. Next up, we have risk factor counseling. So this is counseling your patients on associated risk factors that may come with their conditions. This is going to help prepare them for any challenges that they may face, as well as help them make informed decisions on their management. For example, you could be counseling a patient on the impact of a hearing loss or speech or language difficulties that may come with an associated condition. And lastly, we have appropriate diagnosis description. So this is just making sure that we have no clinical jargon when we're talking to a patient. Our descriptions of our diagnosis needs to be clear and simple because this is going to enhance our patient's understanding of their diagnosis.
The next phase in our test battery is patient education, and this is useful for helping our patients come to terms with their communication difficulty or diagnosis. We have two tools in this area that we can use to foster a successful therapeutic alliance. The first is providing our patients with a comprehensive explanation for their communication difficulty. We can do this by explicitly linking the case history to the diagnosis to give them a whole picture view of their communication disorder and the possible reasons for it. The final tool that we can use is personal adjustment counseling. This allows us to address any of the fears or anxieties the patient may have upon receiving this communication disorder diagnosis. It can also help them to feel emotionally supported throughout their healthcare journey.
And the last tool in our Therapeutic Alliance toolbox is monitoring patient motivation levels. So often when it comes to adherence to follow-ups and to the management plan, it's largely dependent on the motivation levels of our patients, which is why we as clinicians need to continuously check in on our patients and encourage and motivate them to keep working with us.
As you can see, our toolbox is overflowing with skills to address any shortcomings and support the development of a successful therapeutic alliance. All these tools will help us to forge deeper relationships with our patients and improve their healthcare experiences, all while supporting their health outcomes, their mental health, and their emotional well-being. Please join us in the next video. We hope to see you there. Bye!